Hey, this is Andrea Kane, and I'm here with HIT 292, Healthcare Reimbursement. And this lecture is on Chapter 3 in your book, and it is for Week 8. Hard to believe we're here already. If you're looking at objectives, here are the ones that are based on the book, but you can also go back to your syllabus and see we are still on course objectives 8.4, 8.5, 8.6. And those are unit objectives 9.4.1 through 9.4.11, 11, and 9.5.1 through 9.5.5, and 9.6.1 through 9.6.3. So be sure and check your syllabus if you want to see exactly what those are, or check that out in Brightspace. But here we go. We are going to talk about major types of commercial insurance plans. The individual healthcare plans that form employer-based healthcare plans, state healthcare plans for the medically uninsurable, provisions of healthcare insurance policies, elements of a healthcare insurance identification card. Hopefully all of you have a healthcare insurance identification card that you could refer to as an example. The filing of a health insurance claim, remittance advices, and explanations of benefits, and talk about the increasing costs in the commercial healthcare insurance market. Ooh, fun stuff. All right, so let's talk about commercial healthcare insurance. It is either individual or employer-based. Individual means that the person or their family purchased the plan, usually through an insurance agency. Employer-based means your employer is providing it as part of an employment benefit package, and they will cover you and or your family. So it's usually individual, individual and spouse, individual and dependents, or individual, spouse, and dependents. So it kind of gives you those options there usually. It is very much based on what the employer offers, what they have chosen to offer. So some types of commercial health insurance. You have single coverage, which means that's just the insured. And then this is what I was talking about on the last slide. With family coverage, yes, the insured is coverage, but you can also choose spouse, children, as well as if you have young adults up to the age of 26, I believe, are covered, or if you have a disabled person, a permanently disabled person. A risk pool. What is a risk pool? It's a group of individual entities whose healthcare costs are combined for evaluating financial history and estimating future costs. Risk means the probability of incurring a loss. And so what you want to do if you're a health insurance company or an insurance company of any type, whether you're talking about automobiles or boats or motorcycles or whatever you're insuring, your house or your life, they want to get a group of usually individuals and companies, and they usually separate individuals from companies, but not always, or associations, because you can think of places like AAA that offer insurance. But anyway, the risk pool is made up of all of these. And what they want to do is combine the super healthy with the super ill to balance it out. And that's the risk pool. If you have too many people in your risk pool that are on the chronic disease, very high healthcare costs, that's going to create more risk for the insurance company of loss. And so that's when healthcare coverage costs start going up. Versus if you have a lot more younger people who are paying in and not really using their health insurance benefits because they don't need them, or they choose not to for whatever reason, then the risk pool is tilted more to the benefit of the insurance company. They have less risk, they can make more profit, and hopefully they are willing to share that profit by reducing insurance costs to those who are paying. Again, in theory. So types of risk pools, there's an individual pool, it has self-employed people or they work for a company where the employer does not offer insurance. I think it's 8, if it's a small business owner who has less than 8 full-time employees, they don't have to offer insurance. So that would be how somebody could end up having an employer but being in the individual pool. And the self-employed people are people who own their own business or are an individual, a personal, sort of like a contractor. They have a business that they provide services, and they're the only ones that are employed. It is the least diverse pool and is at risk for having the highest disproportionate numbers of sick people, like I talked about on the last slide. And then you have a large employer pool where they may be the employees of one employer. Those pools are typically large and diverse. So think about a healthcare employer. They have a wide variety of ages of people who are employed for them. And although most of their employees may be healthy, they also run some risks with back injuries and things like that with those who move patients or who might get a health infection. So large employer pools, yeah, they're usually large and diverse, and they're usually balanced enough with younger workers and older workers to make it work. Then you have your multiple employer pools. That's from several mid-sized employers or small groups or groups of associations. They have usually the less diverse pools, but their individual pools are larger and more diverse. So you can just see how these 3 types will usually work out. And again, these 3 are not the only 3, they're just the major 3. So keep that in mind. All right, insurance plan terminology. What does it all mean? Benefits mean covered services. The healthcare services that the insurance company is going to pay as outlined in their policy, which is a contract with you or with your employer. They say, okay, we'll provide you these benefits. That means these are going to be things that we will pay for in our policy with you. The policyholder is the person that purchased the insurance plan. It can be an entity, it can be an individual. A policyholder is also referred to as the insured, certificate holder, member, subscriber, beneficiary. Cost sharing provisions. Okay, that's where out-of-pocket expenses come in, where the person who is insured has to pay, or the policyholder, shall we say, has to pay. So cost sharing provisions, sometimes that's the employer. So the insurance says we're going to pay 40%. The employer then says, okay, I'm going to pay another 40%, and the employee has to pay the remaining 20%. That's called cost sharing. It's the out-of-pocket expenses that the insured must pay. A deductible is an example of that. It's an annual amount that has to be paid before the insurance will assume its share of liability. So if you have a plan that has $1,000 deductible, which is not unusual, unfortunately, these days, you have to pay that $1,000 before either your employer or your insurance carrier will kick in and pay their piece. And usually it's the insurance that pays next, and then the employer that picks up the other part, if that's the way they have it. Some plans are simply insurance company and employee, and when that happens, if you pay a deductible, you've got to pay it, and then the insurance will step up and pay their piece. Premiums are payments that the policyholder has to make in return for insurance, or in turn return for the coverage itself. So premiums, if your employer charges you $200 a pay period for your insurance, that's a premium, because that's coming out on a regular basis and it's going directly to the insurer for your healthcare coverage. So you may have a plan. I mean, it is very possible to have a plan with a very high deductible and premiums on top of it. So just be aware of that when you're thinking about that. All right, medically uninsurable. There are some unfortunate people who have some conditions that are considered medically uninsurable, and this is horrible, but true. It can include cancer, CKD, which is chronic kidney disease, cystic fibrosis, genetic disorders, things like that. Um, these are these can be a pre-existing condition or a chronic disease or both. And what the state health insurance plans do is they provide access to healthcare insurance coverage for people who can't get it elsewhere. And thankfully, this is in place in many states. It would be interesting to, I haven't been in Iowa long enough to know what Iowa's stance is, but it'd be interesting to research this for Iowa and see what Iowa provides to the medically uninsurable. But these are individuals who are going to use healthcare services much more than healthier people, and their healthcare costs are higher. And that's why commercial insurance plans don't want to touch them. They know that this is going to be the case. When I was in North Carolina, I ran across this. I had someone who worked for me who had had a form of cancer, and after she was treated, she had a very difficult time getting health insurance. She couldn't be covered by her husband and had to take out an individual policy, and it was extremely, extremely expensive. And at the time, I don't believe she could have qualified for the state health insurance plan, but that was something certainly she checked out. And I've also known that from being in Michigan. Granted, this was a long, long time ago, but I had a cousin who had a condition that she had to have multiple surgeries on her head because on her outside of her skull, she had blood vessels that had grown into sort of like a very, very thick nest, and they had to be surgically removed, and they kept growing back. And her father, my uncle, had an impossible time getting health care insurance for her. And this was before there was a state health care insurance plan for the medically uninsurable. And so they had to pay out of pocket for 2 or 3 of her surgeries, which was incredibly expensive. So thank God for the states that have put this into place for people who definitely need it. And but just be aware that there are some conditions that fall into a category where commercial insurance will refuse to offer a plan for it. Provisions of health insurance plans. Well, okay, we talked about policy, that contract between the insurance company and whoever it is that's the insured. And that's called a certificate of insurance. The policy is also known as a certificate of insurance, and it stipulates the covered conditions. It'll tell you what it will cover and what it will not cover. Now, it doesn't cover the policy, or the certificate of insurance doesn't list out every eventuality, but overall, it'll give you the big ones. It'll talk about whether or not it includes mental health care, whether it includes substance abuse care, and how much. It'll talk about alternative medicine, like acupuncture and some of those other things that have been proven to work, but which health insurance companies typically, traditionally, have not been willing to pay for. So looking at a health insurance policy, if you had one in front of you, what would you be looking at? Well, first of all, you'd be looking at some definitions, and they would vary. You would be looking at the eligibility enrollment. Who is eligible and who is enrolled? All right, so who's eligible? Who is covered? Is there a waiting period? Are there any qualifying life events, such as could you lose your coverage and when? What about marriage? Can you add someone anytime if they marry? Or can you take someone off insurance if they divorce? In terms of birth, if you have a baby, how does that happen so that the baby is added to insurance, or if you adopt? So those are some things that need to be laid out in that health insurance policy. And then benefits. What types of services, providers, medical equipment, things are they going to cover? If there's eye care insurance included, are they going to cover glasses and contacts? Do they cover the LASIK procedure? Those types of things. If you have a regular major medical coverage, do they help you with home health visits? What about hospice or things like that? Then they get into stop loss benefits. At what point will they stop covering or stop paying? At what point do they say, I'm sorry, this is it. The insurance will pay no more. And even if you paid your $1,000 deductible, and even if you faithfully pay your $200 every pay period for your coverage, at what point, if you accrue some type of significant cost, are they going to say, that's it, we're done, we can't cover you? Or at what point are they going to say, if you have paid all of this, we are not going to come back to you for more money? So there are those things. More sections of the healthcare insurance policy. What are the limitations? Are there any cost sharing provisions such as co-insurance or co-payment? Are there any tiered benefits where you are incentivized to use providers or services that are in network versus out of network? And same thing with the pharmacy formulary, where they give you a list of medications that are on their formulary and say, we will cover them and here's your cost to them, versus if you have a drug that is perhaps, say, let's say new to market or a brand name, and they say it's not on their formulary, and what will you pay for it? So there are those types of things. There are appeals. They have to explain what is their appeals process. How do you go through that? If you disagree with something that's happened, let's say that you think it's covered, they refuse it, they're not paying it, and you want to appeal their decision. What is that process and how does that work? Exclusions. What are the non-covered services that no matter what they're not going to do? Usually this refers to experimental or investigational. Sometimes someone with cancer will try experimental or investigational medications that are being developed and tested that may or may not help their condition, but they're trying them. That's usually a non-covered service. If the insurance company believes that it is medically unnecessary, and that's a huge gap, and that's a hard one to fight, because they will have their doctors that say one thing, you will have your doctors that say something else, and they will go back and forth and back and forth and back and forth. But if they think it's medically unnecessary, they'll say, we're not covering it. Typically, they don't cover cosmetic procedures. Anything that has to do with plastic surgery that is not medically necessary. Again, going back to that medically unnecessary. Do you have to have it for your health? If it's something you simply want to improve, odds are it's not going to be covered, and they're going to tell you if you go for it, you're going to have to pay for it out of pocket. And then again, those non-FDA approved medications. So let's say that there's a medication that's in a trial and you get put on it, that they may not cover that. So you have to really look at your policy and see what the exclusions are. And then there is something called riders and endorsements. A rider is an additional document that provides details about coverage or lack of coverage for specific situations. So it's sort of like an addendum. And then an endorsement is information that goes on to define the lack of coverage for special situations. It's just that language that adds that information. So riders and endorsements, think of those as addendums. They'll tell you about additional situations that they will cover or not cover and go into very specific language about those. All right, so we talked about some other sections, and now we're to procedures. They will tell you what you need to do in terms of pre-authorization or pre-certification, in terms of coordination of benefits, and then in other party liability. So let's break these down one at a time. Prior approval means in order for them to say it's medically necessary and that they will cover it, they want to have documentation submitted to them explaining what your current condition is, what your options are, and why this option is the best one for the situation. So it gives you some examples, and I'm going to pick organ transplants because that's the easiest one here in the list to talk about. But they will say, okay, someone says they need a kidney transplant. Well, they need a urologist who has been treating the patient, who is a specialist, to explain that they've been going through all these different steps, they've tried all these different treatments, and now they're to this point where this is the only option available, and the patient is healthy enough to be on the organ transplant list. And so they have to submit all this documentation proving that they've been through all these steps, done all these tests, treatments, and whatnot. It has not worked. The patient is in end-stage renal disease on dialysis, but still healthy enough that they would be a candidate for organ transplant. They provide all this information to the insurance carrier, and the insurance carrier decides, oh, yeah, this patient meets our criteria. We do think this procedure is medically necessary, and so we will give our prior approval or prior authorization or pre-certification to that, so that when the kidney becomes available for transplant, you're not arguing with the insurance company at that point about coverage. It's already been determined that it's a go. And organ transplant surgeries are very expensive. So this is one where you definitely want that prior authorization, pre-certification, so that when the word comes in, the kidney is available, you're heading to the major medical center for the transplant, it's coming in, you're not worried about whether or not the insurance carrier is going to cover it. It's already been approved. And it can be something simple as even a surgery. If you're getting a total knee replacement, or you're getting a total hip replacement, and you've been trying these things and you're doing that, those are types of things that definitely will need prior authorization or prior approval. Okay, coordination of benefits. This is when you have multiple payers involved, and they want to make sure that payments do not exceed 100%. Imagine that. This coordination of benefits typically refers to Medicare, Medicaid is a good example. So a patient has Medicare and Medicaid. Coordination of benefits means that Medicaid will pay first, followed by Medicare. And then the example they give you here is a divorce agreement. So as to what the primary insurance and secondary insurance would be. That's really what coordination of benefits is. Another example might be, I happen to have dental insurance through my husband, but I also have it through the college. So when I go to get dental services, they do a coordination of benefits to identify that my primary insurance is through the college and my secondary insurance is through my husband, and that's how they submit payments. And then, of course, they send me the bill for what remains. So that's an example. Other party liability. The easiest one that I can think of is car accidents. If someone is in a car accident and someone else is responsible for it. I'll give you an example. I know a young lady who is a nurse, and she and her fiance were taking a walk one day. And unfortunately, a couple of individuals decided to race down a 35-mile-an-hour street in the city at 70 miles per hour, and one of the vehicles lost control, went off the road, and struck this young lady and her fiance. They both ended up being airlifted to a major medical center. They were in ICU for a number of days before being transferred to an inpatient rehab hospital. Thankfully, he was out within a week. She ended up having to stay for 2 months. This is an example of, yes, she has a healthcare insurance, and yes, he does too. They both had it through their employers. However, the automobile insurance on the car by the owner, which unfortunately was not the driver in the situation, is going to have to pay first. So they are the one that is the other party liable. So what happens is you have multiple insurers, and they are going to go after the automobile insurance carrier first to pay for the medical care before they go back to either of these individuals' personal health insurance. So that's an other party liability. Another example would be if someone is in a store and they slip and fall. Let's say it's an elderly person. They're in the store, they slip and fall and fracture a hip. The store's insurance will pay first before their medical insurance because the accident happened at the store. So that's another example of other party liability. Hopefully that makes sense. And by the way, that young nurse is doing incredibly well. She is walking again. She will probably never be a nurse, unfortunately, because of the severity of her injuries, but she is getting her life back, and they are planning their wedding. So praise to God. All right, health insurance policy. Oh, more sections. So we talked about definitions and eligibility to enrollment, benefits, limitations, exclusions, appeals, and procedures. And they like to refer to it as a puzzle. So we will let them have their puzzle. But anyway, just know that there are all these sections when you're talking about a health insurance policy. All right, a health insurance identification card. This is just an example. And this is a nice one because it actually lists out what the benefits are. Not all of them do. A lot of them have phone numbers on the back, and they just basically have the member name, their ID number, their group number, and then they say, call us, depending on what it is on the back. So this is actually a nice one because it tells you a bit about their prescription coverage over here on the bottom of the left side, and they talk about the medical and what it gets paid there and what the person needs to pay. So there you go. All right, so filling a health insurance claim. How do you actually submit the claim? Typically, it is done electronically these days. There are very, 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 very few paper claims. But whether it's an electronic claim or a paper claim, you need to make sure it's a clean claim, that everything is in the right spot and is correct. Because if you process a dirty claim, it's going to come right on back to you. And you'll have to figure out what's wrong with it and fix it and resubmit it, which means that it will take longer for you to get your payment if you are working on behalf of a provider or a healthcare organization. And the last thing you want to do is make the whole process that much longer. So it's important to submit clean claims that have gone through edits and been double checked versus a dirty claim which has not gone through edits or has errors or mistakes that no one's caught. Adjudication is a term that means reimbursement based on the member's insurance benefits. So adjudication is, okay, the claim has been submitted, it's being adjudicated to determine the reimbursement that's going to come back. So essentially they're looking at the claim and they're determining how much are they going to reimburse. That's adjudication. A remittance advice is prepared by the payer, sent to the provider, and it tells them, okay, we have sent you this amount of money through an electronic fund transfer. Because remember I said everything is pretty much electronic these days. So the remittance advice says, okay, here's what we've paid you for this person for this procedure or this date of service or what have you. And it's important to get a remittance advice and then compare it during a claims reconciliation process, because you want to make sure that what you submitted for the claim was appropriately paid, that there's not something still hanging out there or something that they refused, so that you understand how that came back to you. And I'm sorry, and here it tells you to look at Chapter 9, and we will get to Chapter 9 when we get to week 13. So you can either jump ahead to Chapter 9 now if you are extremely curious, or you can wait for week 13 and we will cover it then. All right, explanation of benefits. What is an EOB? It's a detailed report of payment that was prepared by the payer and sent to the patient. So notice, remittance goes to the provider that was billing for the services, and EOBs, explanation of benefits, go to the patient, and they say, here's what we've paid your provider and here's what's left for you. So that's what that is. All right. Oh, it tells you to look at figure 3.4 in the textbook and look at the components. So if you've never received an EOB, take a look in your textbook. If you have received an EOB, you might want to dig it out and take a look at it too and just see if now it looks somewhat more familiar that we've talked about it and you've studied it in your textbook. All right. There are increasing costs of commercial health insurance. We talked a little bit about this. It used to be, and I remember this back in the day, unfortunately it was probably 20 years ago, where my health insurance covered me 100%. I paid my premiums, and the insurance company in the hospital that I worked for paid everything else. It was a healthcare system, actually not just a hospital, but they paid everything else. Well, costs for commercial health insurance have gone up and up and up and up and up. Some of that is because there is an increased use of healthcare. Some of it is that there are more people diagnosed with chronic conditions that are seeking out more routine healthcare. And you can argue pro or con on all of these things. I'm not here to say is it good or is it bad. I'm just explaining that there are increasing costs. There are tons and tons of regulations on insurance companies and providers that have added a bit to the cost. So you have all of those, and then there's employers who cannot afford as much as they perhaps used to. When you're talking about healthcare organizations who are the employers, they can't afford as much as they used to be able to pay for that proportion of healthcare insurance that they used to. And so more and more is being pushed onto consumers or those who are insured. And the effects are not good. I think we can all agree on that. The effects of the increased costs of commercial healthcare insurance sometimes causes medical bankruptcy. Healthcare expenses are expensive. And unfortunately, we've seen that. There are effects on providers because the cost of collections and non-payment have gone up. There's so many write-offs, charity care, patients that just can't pay. And so there's the increase in those write-offs. And then the effects on the healthcare insurers are, again, they're trying to do consumer-directed health plans, value-based insurance models, which we'll talk about in Chapter 10, and that would be week 15, and wellness programs. So healthcare insurers are trying to hold costs steady or bring them down, but they still keep increasing. And they're trying to educate consumers to perhaps use less health care or to use health care more wisely or to live healthier lives through wellness programs so that they require fewer medications and fewer interactions with the healthcare industry. And again, you can argue pros and cons on both sides. I'm not here to promote a view. I'm just saying that the increasing costs of commercial health insurance have not been good to consumers or providers. All right, what are consumer-directed healthcare plans? They are trying to reduce healthcare costs by providing consumers with financial incentives to choose lower-priced packages of benefits. This is the ones that are called high-deductible plans, where they offer a health savings account to offset that high deductible so that someone can pay it. They're also offering flexible spending accounts. They're also attempting to decrease what they call moral hazards. They're trying to improve behaviors. Let's just say it that way. They're trying to get people not to smoke, get people not to drink excessively, get people to exercise, get people to eat better, all those types of things it's interesting. I've never heard that phrase, moral hazard. So we are all learning something, aren't we? All right, well, that is it for Chapter 3. It's so good talking to you again. and I will be back shortly to talk to you in week 9 about government-sponsored healthcare programs. Take care and have a great week. Bye.